excited to be here with my friend Thad Dufelmeier from Theodore Drew and Associates. Thad, I'm real excited to share with our audience the many things, the many services that your company offers to travel healthcare staffing firms. I'm excited to have you here. Thanks for joining me.
I'm stoked. Thanks a lot, Adam. I'm glad to be here. I'm really glad we've had a chance to get acquainted and work with Moxie. I think that what we do and the services we provide in our industry really match up, and I'm really glad we've had a chance to kind of work together.
Yeah, that's been one of the most exciting things I think that's come out of this past year for us is just seeing all these other companies like yours that are aligned when it comes to the service offerings and the values that we bring forward in the industry. So I know we're all in this to help make the job easier for healthcare staffing firms. And first question I have for you is, how did you come up with the name Theodore Drew and Associates as your business?
So that's a great question. A lot of people ask, or they think that I am Theodore Drew. So basically, my sons, I have two boys. I have three sons, but the two older boys, when the organization was founded in 2009, are Wesley Drew and Owen Theodore. So it's named after their middle names, the Theodore Drew, and the initials TD match my initials, Thad Dufelmeier. So we do a lot of TD and Associates in our branding and in our conversations. But that's where the Theodore Drew came from. And I just thought that Theodore Drew sounded a little cooler than Thad Dufelmeier and Associates. So
yeah, I think that's actually really neat. That's a really neat story. Now, the other part of that is, what's the third son going to think when he...
Well, yeah, he's going to have the holding company will be named after him as we get all our brands together. So
There we go. All right. So tell me what you guys do.
I appreciate you asking. So what we do is really entrepreneurial in spirit. I've been in nurse about 25 years, and I've been in staffing about 20 years. I cut my teeth in staffing during the days when per diem was kind of the primary game in town in supplemental staffing, contingent workforce, and in healthcare. And as the industry has really grown and matured, the one thing that I've loved about it and makes me, I think, a lifer in this industry is it's absolutely been so stubbornly entrepreneurial. Like, it remains as fragmented now as ever. There's 2,000 companies. And so it really is a real opportunity for individuals, owner operators to really get after it and achieve the American dream, in my mind, of that sky's the limit that we all love about the United States. It sounds corny or whatnot, but really, sincerely, that's really what I love about the industry, and I love participating in it. So as we've grown, my entry into being an entrepreneur in healthcare staffing as a service provider was when Joint Commission came into healthcare staffing. That program came into healthcare staffing, and that allowed me to start a business. And as our business has grown, we've done the best we can to be responsible with our earnings and continue to expand our offerings and invest in ourselves. And so as we've continued to kind of bet on ourselves, it's given us the opportunity to grow into various services.
Yeah, so let's dive into some of those services specifically.
Sure.
So, because you guys have some great programs, and I think one thing that I really want to make sure we talk about that I know a lot of clients could benefit from if they don't have a clinical support team, right? Is that clinical support that you do offer. So can you talk to me a little bit about that part of your business?
Yeah. I appreciate you asking. So that's really the part of our service offerings that allowed us to actually grow as a business, that allowed us to retain clients, because just keeping people through Joint Commission, having it being kind of one and done, isn't the best business model, right? And so because we noticed that a couple of things, that a clinical liaison is a bit of a requirement really to have a healthy staffing agency, and me being a nurse, so I was qualified to play that role. And it also allowed us to really bundle the processes of maintaining a joint commission certification, because the joint commission certification, the initial certification, really is less work than the recertification. And because there's just 4 months of required data gathering and reporting and analysis, right, for the initial. But at the recert, there's 24 months of these requirements that you really need to maintain. And so by bundling the ability of us to handle do not sends and those processes with the data reporting and the joint commission maintenance, and really guaranteeing the research, gave us a real legitimate business offering, right? So that's how we got into it. And that's really what has driven our ability to retain clients.
Yeah, yeah, and what a great model, business model.
Thanks.
And it's so shocking to me. I honestly had no idea about your business. I think up until what, maybe 6 months ago, 9 months ago,
Wow,
something
got
like
it.
that.
Yeah, yeah.
And there's so many, clients that I've come into contact with that can benefit from something like this. So in a
Nice.
nutshell, you guys basically, you can come in, you can help agencies get their joint commission certification. You can
Yep.
help them manage that entire process of the data reporting that has to occur in order to get that recertification completed. And you bundle that in with actual clinical liaison support, like actual
Correct.
supporting the team with the.
Correct. Yeah. So like doing the actual, like, because it can really hit the fan when you're taking care of, you know, a client that's taking care of patients, and you're sending contingent workforce in there that's really taking direct care of these critical patients, right? There's, it's real. And so anybody who's been in healthcare staffing, particularly in nursing, for any length of time, you know, it's not a matter of if, but when there's a bad outcome and you're in the middle of it, as a contingent workforce provider. So what we do is we help really manage those really challenging situations that come up not so often, but when they do come up, they're pretty severe. So we help really kind of make sure that the agency is represented clinically in such a credible way that the candidates as well as the clients have a really great experience, right? That's the focus, because it's easy, as we all know, in our personal lives as well as professional lives, to have a great experience when everything is going perfectly. But when it really goes bad, that's when you really know who's who, right? Among your friends as well as among your colleagues. And so that gives the opportunity for the staffing company to shine and kind of turn lemons into lemonade with their candidates, their employees, as well as their clients. That's really where we focus on that. And then there's the routine stuff, right? So there's like just the ongoing, if you're employing lots of CNAs, or you're in a really busy urban per diem market and the do not sends happen kind of frequently, you need to have an efficient way of managing those do not sends and gathering all that data and logging all that stuff. And there's just the sheer kind of volume of work that we're able to do efficiently. So it's a combination of really putting out big fires, as well as just managing tons of data and tons of like busy work.
Oh, that's fantastic. So what a great service offering.
Thanks.
Yeah, I'm so excited about our partnership. I got to tell you, because I know that
Yes.
what you're doing is absolutely necessary in the industry. So now you've got Theodore, Drew and Associates, but there's also this healthcare staffing hire. So talk to me about
Yeah.
healthcare staffing hire.
So yeah, I appreciate you asking about that. So this is another one of those things where we had to, like, people talk about like luck, right? Is a combination of opportunity and preparation, right?
Mm-hmm.
And so it's one of these things where we've worked really hard, worked at it, doing a good job with Joint Commission, doing a good job with the clinical oversight. And then I got a random call from a technology company looking for content. And so the CEO of this technology company, Empower Solutions, they're headquartered out of Kentucky, Louisville, Kentucky, called me and was asking about content. And because he saw that we did Joint Commission consulting. And I asked him if he knew anything about healthcare staffing, and he knew nothing about it. But he had a technology platform, he had a learning management system. And we were just hearing time and time again about the existing providers of these competency services not really meeting the true needs on an ongoing basis of our clients, the clients we had in common with them. And because the clients were constantly asking for customization, and they were asking for real responsiveness and customer service, and they wanted new content, and they wanted to have a more interactive relationship with their competency providers. And that's where I saw the opportunity. And so this gentleman didn't know anything about healthcare staffing. He did some due diligence, talked to some healthcare staffing companies, and agreed that there was an opportunity. And we also realized that there wasn't really a mobile friendly platform, that the platforms had been built on some older technology. So you had to have a PC, there was some browser stuff. And so we just made it like super mobile friendly. And we decided we were going to provide a completely different experience. We were going to really be super collaborative with the staffing agencies and create content when they needed it, as they needed it. And we were just going to be really, instead of making a product, we were going to really create a proper service, right? We wanted it to be a service versus just a product. And so that's where we saw the opportunity. So we created Healthcare Staffing Hire to compete with the existing players, which I have a lot of respect for. You know, I started my organization in 2005, 2006, and was partnered up with the original founder of Nurse Testing. We were called Nurse Testing Consulting Services originally. And when we parted ways with the founder of Nurse Testing, which went on to rebrand and be Prophecy and was purchased by Relias, you know, I have a great deal of respect for that business, that line of business. And so getting into it, I wanted to make sure that I did justice to that service and did a good job. And I think we've been able to do a pretty good job. We just launched September commercially, got about 50 or so clients. And we really care about each and every client in such a way that, you know, we're now working through the integrations of the ATSs and doing all that type of stuff. But because we've invested in, you know, so heavily in our clinical leadership business, we have a huge amount of bandwidth clinically. We have a large number of registered nurses with great experience working inside of our organization. And that's allowed us to already have the largest library, even though we've only been commercially available for 6 months. So
That's
we're
impressive.
thanks, man. Yeah, we're certainly getting after it. You know, yeah, we want it.
So now we're talking skills competency testing, right? So skills checklists.
Right.
What other
Exams,
things
yeah.
are in exams? Okay, so comp exams, that's exciting stuff. And you're competing with some of the big boys very quickly.
Yeah, that's the whole idea. I mean, and we knew it. I mean, we knew that we were getting into a space that had, you know, no real necessarily new market share outside of like the fact that when I said it initially is that, you know, healthcare staffing is so stubbornly entrepreneurial. We've been able to get some exposure to some of the newer entries into the marketplace, really also through really strategic channel partnering with organizations like Moxie. And there's some newer document management kind of ATS type companies that we've been able to have great relationships with. And I know I'm not trying not to name names, right? I'm trying to keep everything like super neutral. But we got some great partners, you know, that are new in the industry that we're really working together with. Yeah.
Yeah. Very cool. Very cool. So what's next? What's next for Theodore Drew and Associates in Healthcare Staffing Hire? What's on the horizon?
So I think what's next for us, right, is really just about like for this year, like our Q1 goal was to have the largest library in, you know, in that sector. So we have the largest competency library now, and we're proud of that. For the rest of the year, we want to get integrated with all the ATSs because that's really what the next step is for Healthcare Staffing Hire. And for TD, it's really just about continuing to provide really great service and making, you know, ongoing strategic hires, right? So we hired Joellen Ryan in 2020, who is a longtime Joint Commission reviewer. She has equity in the Healthcare Staffing Hire division. and she was a nursing professor for 20 years. We needed her for credibility to really get off the ground, right? To get the VMSs to accept our competencies, we needed that credibility. And we made another strategic hire recently because we provide credentialing services for our clients. And that's really been the bread and butter of our growth. And that's where our earnings are really coming from. So we had 50 or so credentialers at the start of the pandemic, and we've got 140 right now.
Wow. Wow.
So we've grown, and we've got some enterprise level clients. We've gained some credibility, and we also have the technology with the healthcare staffing hire. So we made another strategic hire. We hired a VP of operations level person who was with a big company out of the Cincinnati area. They were acquired by another bigger company, one of the big public companies. And so she became available. She was actually a client of ours. And so we were stoked, and we snatched her up. And so now we have her name is Susan Meyer. We have a real enterprise level account management person to handle the enterprise level accounts with credentialing, because, and we use Moxie to train all of our credentialing people. So because you guys are an industry standard, and we certainly want to be meeting industry standards, right? But that being said, how complicated credentialing is in best case scenarios, right? So managing enterprise level credentialing is really complicated and requires somebody like Susan's level of experience and ability to make sure things are going well. It's hard work. So for us, it's about just really continuing really high quality work. Like, we have two main things that we want to do, Adam. It's like, we want to be really easy to work with, number one, and we want to do a really good job, number two. Like, if we do those two things well, we'll probably be okay.
Yeah, really easy to work with and really hard to not work with, right?
Exactly.
Right. We want to be valuable. Yeah. And so that credentialing piece, now that's something you just slid in there, but that's also a big service offering, right? So talk to me, like, you're actually managing the entire credentialing process and onboarding for travelers.
That's exactly what we do. So that's exactly what we do. And we see it, there's like two major components, right, to the onboarding process. There's this relationship side where the candidate really needs to know that they're in good hands with somebody who's competent, knows what they're doing, going to get them to their assignment on time, right? And they also need to know, not the candidates necessarily, but the other component is the document management piece, right? You've got to be able to be really quick and organized with your documents, sorting, labeling, and getting that stuff uploaded into those VMS portals and into your ATSs. That document management piece is not to be underestimated. So those are the two major components that I think make up the credentialing process. And we do both, and we work really hard at, making sure we're delivering that service reliably and, and with really high quality. And like anything else, it's certainly easier said than done. Like, we have to, we got to put out fires, man, because, there's times where, balls get dropped and mistakes get made. And that's, and it's how you respond in those circumstances that really, make or break your organization, right? It's like, there's going to be some mistakes, but it's like, are you responsive? Are you taking ownership, and are you making adjustments quickly? That's what really, I think, determines the success.
Yeah, it's kind of like what you said earlier when you said, everyone can be, great when things are going well, but when, stuff goes sideways, it's how do you respond really defines you. So no, that's fantastic. Now, one final question I want to ask you is, I know you referenced kind of enterprise, and you also referenced this entrepreneur, right? So there's this single business owner. What does your client base look like? Like, what does your ideal client look like? What are they searching for in their businesses? I want to help you connect with those partners.
That's a great question. So we've been able to, prior to the credentialing, when we were kind of just doing joint commission and just like clinical oversight, the real sweet spot for us was like that $5 to $20 million company, right? Because they were still small enough. They didn't necessarily hire the big 6-figure clinical director type. And there was a real advantage in working with an organization like us. But with the credentialing and the business process outsourcing services that we've been able to succeed at over the last kind of 4 or 5 years, now it's the entire range, right? So the publicly owned, big boy, multi-billion-dollar organizations, we're just as comfortable with them as literally the brand new startup who doesn't even have their contract yet. Like, we can now fully service the full gamut. For the first time, we've been in business about 11 years. So for the first 5 or 6 years, we really had a real clear sweet spot. Now it's like we can service anybody and everybody because we've got the technology stuff and we've got the big kind of BPO type services. And so that's opened us up, like genuinely to the entire market.
That's exciting stuff. Well, that's fantastic to hear
Thanks.
about. I'm excited for you to start growing those partnerships with some of the Moxie clients that are out there as well. And
100%.
Again, I see this great synergy between our organizations. So I want to congratulate you and your team on the tremendous growth and the amazing offerings that you have available for travel healthcare firms. So thanks so much for joining me, Thad. I really appreciate it. It's good talking to you, buddy.
Yeah. Thank you so much. Thanks for the opportunity, Adam. I appreciate being able to tell my story.
Absolutely. Take care, man.